Good afternoon, everybody. Thank you for being here today. I am again joined by Dr. Joe Cantor with the Louisiana Department of Health. He'll have some information for you in just a few moments. I want to start off today by acknowledging that this week is the National Public Health Week, and I've signed a proclamation recognizing all of Louisiana's public health workers who have served so well and so selflessly over this past year plus now. And I would say compassionately and very effectively during this pandemic. There are a lot of people who've worked behind the scenes. You don't see them, you don't hear from them, they don't get singled out for the recognition that they deserve, but they've helped us every step along the way during this pandemic. And I want to thank them all today. I will tell you that LDH's epidemiological team has worked around the clock to contact trace, to set up robust testing sites, to collect data that we use to make our decisions. The public health team is integrally involved in our efforts to efficiently and equitably test in a very robust fashion, vaccinate in a robust fashion as well. So to all of our public health workers around the state of Louisiana, thank you. We are grateful for your work today, this week, every week. Today, we are reporting 442 cases on 20,350 new tests. Unfortunately, we are reporting 15 new deaths for a total of 10,200. And I was so excited when we reported 4 deaths on Monday, and that was the first report in 4 days, I think, because of the long weekend. I'm thinking we must be getting really close there to a day when I can announce that we don't have any deaths to report. However, that has not been the case, and again, we're reporting 15 new deaths today. And just want to continue to remind people those are not numbers, those are not statistics, those are our brothers and sisters who are no longer here with us. There are 301 people across the state with COVID-19 hospitalized. That is the same as yesterday. 44 of those patients are on mechanical ventilators. That's down by 2. We are 8 days into the month of April, and we have reported just shy of 150,000 tests. So the testing volume is down a little bit from where we saw it in December and January, but it's still very significant and robust. And because we still see steady or slightly declining percent positivity, then we have a really good indication of what's actually happening out around the state of Louisiana with respect to COVID. We are encouraged by many of the numbers that we are seeing. There are reasons to remain cautious and concerned, and they really haven't changed over the last several weeks. You know, while the state as a whole is certainly doing better, and the baseline numbers look good and are holding, there are certain regions of the state, still principally southwest Louisiana, where it remains the case, I believe, and I think Dr. Cantor will comment on this later, that more than half of all the suspected and confirmed cases of the UK variant, the B117 variant, are coming out of that region. And you don't want to make too much of that because people in all the other 8 regions say, well, we don't have a problem. No, it's in all 8 regions, and I believe that Dr. Walensky, the CDC director, has stated over the last couple of days that the UK variant now is responsible for most new cases across the country, which is causing a lot of concern. So Dr. Cantor is going to speak to some of this in just a moment. But it remains the case, and I know that this sounds like a broken record, but until the facts change, the message has to stay the same. The number one thing we can do right now, besides continuing to wear our mask, is to get vaccinated. And so we're going to continue to talk about these 2 things, mask and vaccinate. That should be our collective effort now and going forward. But this month of April is critically important for our success. This is how we protect ourselves, our families. This is how we bring Louisiana back and restore more normalcy. Today, we are excited to announce a new vaccine hotline as part of our Bring Back Louisiana campaign. It can be used to schedule a vaccine appointment, to find vaccine providers, to connect with medical professionals who can answer any questions that you might have about the vaccines. The hotline number is 1-855-453-0774. The hours of operation are 8 a.m. to 8 p.m. Monday through Saturday, and then noon to 8 p.m. on Sunday. I'm going to give you the number again. It's 1-855-453-0774. And at this time, I'm going to ask Dr. Cantor to come up. As usual, please direct any questions you have to him while he's up here, and then I'll return once he's done and conclude and take your questions as well.
Good afternoon. Thank you, Governor. Thank you for your leadership, and thank you for recognizing the public health workers that have really been going nonstop for 13 months now, and particularly the epidemiologists that you mentioned have just been unsung heroes working in the background, but have been our eyes and ears, guiding us with data, showing us which way we have to go. So let me add my voice to the appreciation of what they've done. We're in a position, as the governor said, where there's a lot of encouraging news when you look at COVID in the state, Louisiana, but still a good reason to be cautious. I'll get to that just in a moment. To talk a little bit about vaccines, as the governor said, we have 2 million shots in arms, which is an encouraging metric for the state. 28.1% of the state's population has initiated the vaccine series. In 65 years of age and older population, that's 71.1%. 18.7% of Louisiana has completed the vaccine series, and the rollout continues to go well. The hotline that the governor mentioned is a really important addition to the Bring Back Louisiana campaign. I'll say that number one more time. It's 855-453-0074, and it's open till 8 p.m. 7 days a week. This is a number that anyone can call if they want help connecting to where vaccine events are or vaccine availability is around them, if they need help to make an appointment, if they have questions about the vaccine, about the types of vaccines, and about what side effects are out there or the safety. This hotline can make people appointments, and it can connect people to medical professionals to help answer those questions. So it's a really, really great resource. It's a particularly good resource for anyone that has limited access to the internet. And we're really, really excited about that. I can tell you, I got word earlier today that as of noon today, we had turned this hotline on today as kind of a soft launch before the formal announcement, which is right now. It was open. And as of noon, we had 10 people call in, and 8 people made appointments through it. So it's working really, really well, even before this formal announcement. So I do encourage people, if you have questions about the vaccine, if you have questions about where you can get the vaccine close to you, or if you need any type of help making an appointment to get the vaccine, that hotline is the best source to go to, and it's 855-453-0774. Let me review quickly the vaccine that we'll be getting in next week's allocations. Coming up, we'll be getting, for Pfizer, a total of 64,350 doses. That's just over 2,000 more than we got this current week. The same number of Moderna shots, which is 47,000. These are all first doses, I'm saying. And unfortunately, the supply of Johnson & Johnson is going through some variability nationwide, and while we got quite a lot of Johnson & Johnson this current week, next week we're only going to get 8,000 doses of Johnson & Johnson. The White House informed us on the call this past Tuesday to expect some variability in the supply of Johnson & Johnson through the month of April, and then it should stabilize and increase in the month of May. Johnson & Johnson continues to be a very popular vaccine. I think a lot of people like the one-and-done nature, and so we're certainly eager to get as much as possible. I'll add more and more vaccine continues to come to Louisiana by way of the federal retail pharmacy program, which is a really good program and is growing this current week, a total of 111,540 doses of vaccine came to Louisiana in addition to our state allotment through the federal retail pharmacy program. Taking a step back now, we are tracking very closely what we consider to be breakthrough cases. So these are very, very small numbers of individuals who get fully vaccinated and then do go on to have a positive case of COVID. You know, the framing of this is that no vaccine for any disease is 100% effective 100% of circumstances. And the vaccines that we have now, you know, in trials were extraordinarily effective, you know, 95% and upwards of that, but not 100%, and that's important to recognize. So our team's doing a good job of tracking these cases. I can tell you, as of today, there have been 170 breakthrough cases, which represents 0.02% of everyone in Louisiana who has completed and become fully vaccinated. And again, fully vaccinated means 2 weeks out, 14 days out from either completing the series if it's a 2-dose series, or 2 weeks out from the Johnson & Johnson dose. Of those 170 cases, the age range has gone from 23 up to 98, with a median of 68. 65% of them have been women. Just over half, 53%, were symptomatic. The balance were asymptomatic. An average of 34 days elapsed from the completion of the vaccine series to when the positive test came in, and 11 have been hospitalized. That hospitalized number represents 0.001% of everyone who has been fully vaccinated in the state of Louisiana. This is in line with what we would expect from the data we saw with the trials. It's actually much better than what we would expect in the data we saw with the trials because it's such a small percentage. But we'll track this closely, and I'll update you regularly on what that number is. COVID as a whole, when you look at the state as one state, continues to go down in Louisiana, and that gives us a lot of encouragement. Percent positivity this week is at 2.3%. That's the lowest number we've had, you know, really since the initial surge. So, you know, it's a very encouraging mark of where we are. Hospitalizations, as the governor mentioned, are just a tick over 300, which is also a very good number for us. So on a whole, we are encouraged that we continue to make progress in driving down transmission of COVID-19. And this week, more than half of the parishes are in the lower 2 of the 4 risk categories that we have. All of that is very encouraging. That said, there remains to be good reason to be cautious. And I wanted to go through a couple of those reasons now. First and foremost are the variants that the governor mentioned, and right now, particularly the B117 or the UK variant. So again, with the caveat that we just don't do enough genomic sequencing in this country. There are 222 confirmed or suspect cases of the variant in Louisiana. The majority of those, although not all of them, are coming from the Lake Charles area, the southwest corner of the state, but they really are corner to corner in all the state. And again, it's a tip of the iceberg scenario where when you don't do a whole lot of genomic sequencing, more and more is happening, but not enough in the grand scheme of things. When you have 222 confirmed, or presumptive, you know you have many, many, many more that are out there. The CDC does random sampling of blood samples that are sent to reference labs like LabCorp and Quest, and through that, they can estimate percentages of the variants circulating. The caveat on this is it's data that's a few weeks old, because it takes them a few weeks to process this. With a few weeks lag time, the CDC is now estimating that 13.4% of all the COVID in Louisiana is the B117 or the UK variant. I'm going to compare that to some other numbers, 13.4%. The US number is 27.2%. Florida is at 34.5%. Texas is at 25.2%. We're doing much better, both nationally and compared to big players in the region. in terms of that variant, and I think you can see that show with how well transmission has been reduced. But that's not a guarantee that it's going to stay that way. In fact, quite the opposite. Our numbers are going up because last week we were 3.5%, and now we're 13.4%. And it's going to continue to go up. And as the governor mentioned, Dr. Walensky, the director of the CDC, said that on preliminary data, the U.S. number is actually now above 50%. So this is going to continue to go up and go up and go up. There are two things that we can do to protect ourselves from this variant causing another surge. Listen, we already know the variant is more transmissible. We know it's more virulent, which means it's more likely to put people in the hospital. There are two things that we can do to protect ourselves from another surge. One is to do more mitigation measures, which we've been doing for 13 months, and I don't think anyone is keen to do more of, to be frank. The other is increase vaccinations. Would much rather do the latter. I'm following closely what's happening in the state of Michigan right now. Michigan's going through a very, very big increase. They're about having as many cases day on day as they did in their December surge, which is concerning. And we're now hearing stories out of Michigan that hospitals are getting very close to capacity. Michigan percentage of the variant is 39%. And that's a couple of weeks old data. It's surely higher now. What really gives me concern is that Michigan actually is doing a little bit more vaccinations than we are in Louisiana. They have 32% of their state's population have initiated the vaccine series. So that tells me that while we have a good base of vaccination coverage in Louisiana, and that base is not insignificant, 28.1% initiated is not insignificant. It's not herd immunity. It's not 100% protective. And look what's happening in Michigan as evidence of that. So we are fortunate now in that Louisiana does not have as much of the variant as the U.S. does and as some of these other states do, even our own region. We're fortunate. We have to capitalize on that. And we have everything going in our direction now. Transmission has been reduced in Louisiana. We don't have as much variant as the rest of the country does. And the weather's been absolutely gorgeous, so we can spend time outside. All of those are in our favor and will be for the next few weeks. We have to capitalize on that, and that means increasing vaccination. So I'll leave you with this. Don't wait until you get sick with COVID. By that point, it's too late. You've already gotten sick. Get vaccinated before that. Take the opportunity to get vaccinated. If you've already been vaccinated, again, I'm going to encourage you to reach out to your friends, family, and coworkers, share your experience, share facts, tell them what it was like, and encourage them to get vaccinated too. That's going to be the best protection we're going to have to prevent against a possible surge as a number of other states are experiencing now. I'll pause there. I'll be happy to answer any questions if there are any. Yes, sir.
Talk about how the demand for vaccines compares with the supply we have. And I know the department put out a memo a few weeks ago asking providers to notify the state if they had extras doses left over at the end of the week. How many doses are you guys seeing moved around and redistributed, on a weekly basis?
Not a ton. I don't have the number off my hand, but providers have done a really good job of using the vaccine that has been sent to them. We communicate with providers on both ends of how much they're going to receive in a week, and providers will say, I can use more, we'll try and find more, or I have enough, I'll take less. So that communication has gone well. Look, there's no question, I am eager to see more vaccinations. Absolutely. We were supply limited, really up until, let's say, maybe a week or two ago, in that what we were getting from the federal government was very, very limited, and we were moving it out quite quickly. Looking forward, the amount that we're going to be receiving is going to continue to increase, and not only on our state allocation, but also what we're getting through these ancillary pathways, like the federal retail pharmacy program, and also the FQHC program, which I didn't mention. We're going to continue to get more and more doses, and we're going to move into a less supply limited situation, which just means that we need to be doing more work on ourselves to increase people's comfort with the vaccine, reach people where they are, create the opportunities for people to have questions and increase access. That really is what the Bring Back Louisiana campaign is all about. That's why we're putting a hotline out there. You know, as we go forward, it's not going to be an issue of having supply that limits us. It's going to be an issue of how well we're reaching people in the state and how comfortable people in the state feel. Yes?
Dr. Cantor, with those breakthrough cases, the 170 you referenced a minute ago, are y'all seeing more of those cases with a certain one of the 3 vaccines, or is it kind of spread out evenly, or are y'all tracking which vaccine those people with cases got?
It's fairly even. It's fairly across the board. And, you know, presumably there are people that are asymptomatic and would be a breakthrough case that we don't know about. Some of the asymptomatics were identified through routine screening, like in a congregate facility or so. But it's pretty spread across the board on that. Yeah. Yep.
And I'm sorry, I haven't been here for several weeks, so maybe you've answered this, Dr. Cantor, but what is the Department of Health looking at to see what hesitancy there is in terms of getting the vaccine? So, like, are you guys doing your own poll? Are you looking at an outside poll? Are you talking to providers? Like, can you, how are you guys gauging that?
Through a number of avenues, and there's been a lot of good work on it. There's good partnership with the Louisiana Public Health Institute. They ran focus groups and did some specific investigations and polling on this. And we certainly pay attention to the other polls that are out there, which I'm sure you've seen. When we talk to people consistently, I'll tell you, what we don't hear is people saying, I don't want it. Never. You know, we don't see people, let's say, refusing it. What we see is people with a lot of questions, understandable questions. And let's face it, some parts of COVID have been very confusing. People with a lot of understandable questions that really tells us that there's an opportunity to create conversations in there. What we have found is when people learn that, for example, why did the vaccines get developed so quickly? When they learn that it's really not because any corners were cut, but because red tape and bureaucracy was cut with the approval process, we find that that builds confidence. When people hear from friends and family who have gotten the vaccine and hear their experience, we find that that builds confidence. And most of all, when people hear from their own medical provider, that builds confidence as well. To that end, we're really working hard now to let smaller and smaller medical practices receive vaccine and stock it. People's own medical providers continue to be a really, really trusted source, and that's going to be an effort going forward. Great. Thank you.
Thank you, Dr. Cantor, and I appreciate your work, and I know the hours that you put in addition to the other job that you have as an emergency room physician. And the people of Louisiana have been extraordinarily well served by your efforts, and I appreciate it. Before I take your questions, whether they relate to COVID or something else, I want to spend just a minute on the legislative session that's going to start 2021. Next week for the 2021 session. I know that you've already seen the executive budget proposal that we put forward. It's obviously a balanced budget that focuses on education primarily. I continue to believe education is a great equalizer, and it is what affords more and more Louisianans opportunities for success, and it's what's going to transform families and communities. And trying to make sure that we have stable funding there and pay our teachers better and so forth, incredibly important. Trying to make sure that we appropriately spend the funds that we're going to receive from the American Rescue Plan, focus that one-time money on one-time expenditures such as infrastructure, debt relief, replenishing the Unemployment Insurance Trust Fund, and so forth. And it's a fiscal session, and so tax reform is being discussed, and it should be, and I'm certainly in favor of things that constitute real reform. I have previously supported 15 out of 16 recommendations that came from the task force created by the legislature, continue to support the ideas that were put forth there. I would just caution everyone that the package as a whole needs to be revenue neutral for several reasons. One of which is we already have one of the 5 lowest combined state and local tax burdens in the country. Secondly, we know that in 2025, we're scheduled to lose the 0.45 cents of sales tax. That's $500 million a year in general fund that will be gone. And what we can't do right now is create another structural budget deficit, a fiscal cliff, if you will, much like was done previously, and that's the situation that we inherited in 2016 with a $2 billion budget deficit. And on top of that, the American Rescue Plan has provision in it that says you can't use those dollars to make up for revenue that you lost because you decided to cut taxes. And so for all of those reasons, we need to be revenue neutral. I'm heartened by the fact that legislative leadership and for the most part, the authors of the various bills are also talking about revenue neutrality. And, you know, I think it would be tempting to say, well, we've got this money coming from the American Rescue Plan, so we can afford to do some other things and destabilize our budget. Well, that wouldn't make any sense because, as I mentioned before, one-time money needs to go to one-time expenditures. Secondly, that's exactly what happened after Katrina, during the Katrina recovery. And we should never make the same mistake, especially one that we're just now starting to overcome. We've got a lot of moving parts in this session that are coming up as it relates to the budget, the rescue plan dollars, and as of yet, by the way, we don't have any final numbers on exactly how much the state's getting, how much each local political subdivision, what the rules are going to be around the expenditure of those funds. And the funds are supposed to be available 60 days after the act was signed into law. We're about halfway along, and so those rules and numbers could come any day now. Certainly, we want to make sure that we're preparing so that we can take care of this business during this 2-month session. It absolutely should not be necessary to have a special session in order to deal with this. I am committed to more pay for K through 12 teachers and support staff. That's in the budget proposal that I have put forward. I'm also committed to the first faculty pay raise that's been in the executive budget proposal in 15 years. I think that's very important. To fully fund the TOPS program, and then to also better fund GO grants, need-based aid for higher education is also important. And then just generally stabilizing budgets for higher education institutions. REC will likely meet again before the Appropriations Committee in the House or the Finance Committee in the Senate takes up the appropriations bill. I think there's a chance they will recognize more general fund revenue. And if so, I want to make sure that we use as much of that as we can to increase teacher pay even further within reason, and then look at additional investments in early childhood education. I've been meeting with legislators. Earlier this morning, we released the legislative agenda that you probably have had a chance to look at. I believe that we ought to pursue bipartisanship to the maximum extent possible. We ought to be seeking fairness and opportunity for everybody in Louisiana, which means that I'm going to support bills to help fix Louisiana's gender pay gap, which remains among the very worst in the country. I want to support efforts to end discrimination in the setting of auto insurance rates where premiums are based on things having nothing to do with an individual's driving record. I support mandatory reporting for Title IX violations related to sexual assault and sexual harassment by higher education mandatory reporters. I support legislation by Senator Cleo Fields on mandatory kindergarten, a bill by Ted James in the House of Representatives on reforming how law enforcement officers are disciplined, and also things like creating a statewide coordinator for the Americans with Disabilities Act to make sure that disabled Louisianans can visit but also work in state government and in local government as well. Creating the Office of Human Trafficking Prevention and putting that in the governor's office to better focus our efforts on that, which continues to be a serious issue here and around the country and indeed around the world. So the theme here is fair access to opportunity, in Louisiana, and that certainly includes increasing the minimum wage, $7.25. It has been since 2009. Unlike previous years, I'm not going to lend my support to a single bill. I support all of them. Whichever one the legislature wants to embrace and pass to increase the minimum wage, I'm for it. Put it on my desk, I'll sign it into law. We are way overdue. And by the way, the overwhelming majority of people in Louisiana support this. And the idea that someone would work full-time for a wage that doesn't meet their most essential needs is just so backwards. And it's something that can be so easily addressed, and we really shouldn't wait on Congress to do it. One more thing before I go into questions. I don't have to tell you all and people across the state that COVID has made things different for the last 13 months. This is going to continue for some period of time, although we are experiencing more normalcy over time. This month is going to be critical in our overall efforts to get to a place where we're not going to be subject to a surge, causing an awful lot of people to be sick enough to go to the hospital and to die and so forth. But there were some things that won't be fully back to normal. The legislative session will start on Monday, but I will not be addressing a joint session in the House chamber because that would violate the CDC rules on gatherings and putting that many people in such a tight spot. So we're not going to do that. Instead, I've consulted with President Cortez of the Senate and Speaker Sexsnyder of the House, and I'm going to give my speech Monday evening, right around 6 p.m. at A.W. Mumford Stadium on the campus of Southern University here in Baton Rouge. We will be inviting legislators, other special guests, and media partners, and so forth. This way everybody can be safe while we give the State of the State address. Should it rain, we do have a backup site there on Southern's campus. I'm actually excited to get back to Southern's campus, and they've been working very hard on COVID testing, but also now on vaccines as well. And they make their campus available for vaccination efforts for the entire community, and I appreciate that. Also look forward to being back in the stadium when it's full of fans cheering on the Jaguars for a football game. And then maybe in 2022, we'll get back to a fully normal legislative session. But until then, we have to focus on getting past this pandemic. And so I encourage people to keep wearing your mask, distance, and of course, get your vaccination as soon as you can. In case I forget, in addition to the State of the State on Monday evening, our next press conference is scheduled for a week from today. So with that, I'll be happy to take some questions. Seeing none, I'll go home. Yes, sir.
Governor, in light of what's happening at LSU right now, the Committee on Women and Children met this morning. Some of the lawmakers on the committee, some of the LSU students both expressed frustration. There were no firings or terminations after what happened. Do you think there should have been?
Well, I think there should have been, but if you look at the report, the Husch-Blackwell report, I don't think there's any doubt the most egregious behavior were by those who are no longer at LSU and haven't been in some years. And so, you know, in terms of whether I believe that people who are currently at LSU need to be fired, based on the information that's been made available in that report, I accepted the measures that were dispensed by the LSU president as being within the reasonable range. And, you know, so I'm going to leave it there. Obviously, if new information is developed and determined to be true that casts current employees of LSU in a bad light to the point that they should be terminated, then that's subject to change. But I don't think there's any doubt. People involved in everything that's been reported at LSU needed to be fired, but that should have happened going back to 2013 and 14 and 15 and so forth. And I accept as reasonable what LSU has done with respect to those people who are still at LSU based on that report, the Husch-Blackwell report. Yes, sir.
Governor, going off Title IX, two questions for you. you. Obviously, lawmakers were downstairs today with another hearing. Obviously, LSU officials, a slew of them were asked to testify. They did not show up. Do you believe lawmakers need to hear and then deserve to hear from LSU officials like Coach O and Scott Woodward, who ultimately did not show up at some point? That's my first question on Title IX. And then kind of going off of that first question, obviously in that Hush-Blackwell report, the two people that were punished, Verge Osbury and Miriam Seeger, were suspended. But in that report, Osbury is painted as being told directly about Drake Davis, I guess, engaging in domestic violence and not reporting it as he should. Do you believe Verge Osbury should still be employed at LSU? Do you believe he's a good representative for the state's flagship university?
Yeah, and so I'm gonna refer you to the answer I gave in the previous question, because I think it addresses your question, and I think it's the case because in light of the institutional failures and the failures of leadership above Mr. Osbury, for example, and I think I accept that he didn't properly report. But there's reason to believe he reported the way he was told to by his supervisor, by the person that he worked for. And so in that light, in the grand scheme of things, do you terminate Mr. Osbury? And the president of LSU indicated to me that he didn't think that was warranted in light of the Hush-Blackwell report. I accept that. And then, you know, as a lawyer, I would have objected to your compound question, because now I'm going to have to try to remember what that question was.
That first question was, in light of those LSU officials not showing up to that hearing, do you think lawmakers deserve to and need to hear from people like Coach O. Scott?
Yeah, I think it would be very helpful and instructive to hear from them. For example, though, I want to say that the athletic director was there at a previous hearing up until about 7 o'clock at night. They didn't get to him. And what happened, as I understand it, between then and now is a lawsuit has been filed, and that does change whether LSU, an institution, ought to be offering people up to give testimony on the record in light of the litigation that is now pending. So I don't believe it's fair to say that people at LSU were unwilling to come forward and to speak. But this intervening act with this litigation being filed, I do think changes some things. And I'm just, I haven't had the benefit of being able to watch those hearings because I've been doing other things, or to have a conversation with the folks at LSU about this. But I do know from my memory, the athletic director was, whether it was last week or the week before, I really don't remember, there to testify up until about 7 o'clock at night, and was not called to testify before the meeting adjourned. But I want members of the legislature and I want members of the public to have as much information as possible directly from those who are involved. But whether that's even now possible with the pending litigation, I'm just not sure. Yes, sir.
Help us understand what role you're playing as the governor to help right the ship at LSU amid this scandal.
Yeah. Well, I was able to receive the Hush-Blackwell report, I think, a day or two in advance of when it was made public. I was able to read it, meet with the president and the chairman of the board, and just told them that it was absolutely essential that report be made public as soon as it possibly could. It was. Told them it's absolutely essential that every single recommendation Hush-Blackwell made, and I think it was 17 or 18 of them, be fully embraced and implemented by LSU just as soon as possible. And that, too, is going to happen. I told them to make sure that there is no way, and this is the message I hope people will get both in Louisiana and around the country. The days of protecting an institution are gone. There is no protecting an institution of higher education at the expense of those that you're supposed to be educating. So the safety and well-being of students and student athletes, and the knowledge that they have that they're going to be safe, and that their parents have that they're going to be safe, is critically important. And there is no advancing an institutional agenda that in any way compromises that. So full transparency, taking the appropriate action with whatever information comes forward is absolutely important. and that should be what LSU is about. And so that's the role that I have played thus far. That's the standard that I will hold LSU to. And by the way, you know, we're talking about LSU, and we should, because that's the report and that's what the committee is focusing on right now. But I've also met with every system president of all of our higher education systems to make sure that they are taking advantage of this opportunity to see what those recommendations were with respect to LSU and how it strengthens its leadership and the reporting requirements and the policies and making sure they're complying with the law and with Title IX, and make sure that they are advancing all of those recommendations if, in fact, they don't have them in place already, too. Because as governor, I don't want to focus on LSU to the point where we're not looking at any other institutions. And I don't have any information to tell you that there are cases at these other institutions, but they're going to be just as unacceptable there as they have been at LSU as well. Yes, sir.
For the mandatory kindergarten bill, just looked up the fiscal note. $2 million to $12 million is the projected cost. Is there enough revenue in the current projection to pay for that, or is that something else where you would need to see what the RIC does?
It's a great question. And so right now, most people think elementary and secondary education, you say K through 12, and you just kind of assume K is mandatory. Well, it's not. But we believe it's only about 2,000 kids who are not in kindergarten. And the bill is going to allow them to satisfy this by enrolling either in public school, private school, or parochial or homeschool. So not all of these kids, not all of the 2,000 or so, are going to end up enrolling in a public school and requiring MFP dollars. If all 2,000 or however many are out there do, we will be able to absorb that. And the truth is, when you look at the MFP, it always fluctuates, and we count in September, we count again in February, I believe. There are always fluctuations that are greater than the amount of kids that we're talking about. And then what's the cost of not having kids in kindergarten? That has to be looked at too. So we're committed to it. It's the right policy. And will it cost a little bit more in the MFP? Yeah. But it's an investment that's well worth it and easy to absorb in a system as large as we have in K through 12 education in Louisiana. Yes, ma'am.
So I think back to LSU, some of the women lawmakers today, many of them said that they did want someone fired. And I'm curious about why you think you are not necessarily on the same page with them.
I would be interested to know who they want fired and for what reason, and whether it's something that was in the Blackwell report or something that may be circulating in the news media. I mean, I don't know how to answer the question based on the way you presented the question. I'm sorry.
Okay. Have you heard from anyone at LSU that they may be considering firing anyone based on new information that's come out this week or new allegations?
Have I heard from anyone at LSU?
Yeah, has anyone
No.
told you that they might be thinking about firing people?
I have not. And of course, new information that comes out has to be verified to some degree. It has to be investigated, corroborated, or whatever. And quite frankly, if something comes out in the newspaper this week, or maybe even in the lawsuit, I wouldn't expect LSU to be in a position right away to know whether they accept it as true or not, and have changed their decision making.
Last one?
Yes, sir.
On that note, today we heard criticism of the Hush-Blackwell report that it only delved into issues that had previously been reported, or at the time of the report and the investigation had only been reported in the media to that point. Since then, we've seen new information emerge through committee testimony and additional media reports about incidents that occurred with many of the current players and coaches at LSU. Does there need to be additional investigation? And furthermore, there have been some calls to involve the legislative auditor. Does there need to be further investigation, and what role would the state, if any, play in that investigation?
Yeah, I'm not sure that, and it may be fair, I'm not sure that it's fair to say that the only thing dealt with in the Hush-Blackwell report were things that had previously been in the media, because towards the end of the report, if memory serves me at least, I read about some things that I don't remember ever seeing in the media. Whether all of the hearings and the information that is coming forth, whether it's in litigation or whether it's with individuals testifying or in media, if that sheds light on things that weren't previously known or taken up by that report, then it certainly may warrant a new investigation, whether it's by a firm like Hush Blackwell or some other firm. I'm not sure. I mean, that may be warranted. I don't know right now, based on the information that I have, whether it is. But this is what I can tell you. My expectation is that the folks at LSU, if in fact that's the case, that they will be commissioning whatever investigation is warranted. Again, I don't think that anything other than full transparency solves the problems that are going on and gets us past them. And the student safety is number one priority that I have, and I have been assured by the folks at LSU that also is theirs, and they want those students and those students' parents to be absolutely confident of that. And there's no doubt that all of the things that were contained in the report, the things that are being discussed in committee, none of those things can make you feel really good about the way things have been going on at LSU, going back to, I think it's back to 2013 or among the earliest dates there. The question now is what do they do now? And that's, I think, the most important thing, and full transparency and making sure that they understand that nobody is beyond reach. We don't have people anywhere in Louisiana who are irreplaceable. Nobody is untouchable. So wherever the facts lead, that's where they need to go. Look, thank you all very much. Again, we'll see you Monday night, hopefully, and then this next press conference will be on Thursday of next week back here in the press room. Thank you all.